Hello everyone, I am Dr. Poonam. Today we are going to learn about the mandible, the bone that forms the lower jaw. The word mandible is derived from the Latin word mendere, which means to chew, and chewing and mastication is the main function of the mandible. This bone is mandible. It forms the lower jaw and has sockets for lower teeth. This is the longest and the strongest bone of the facial skeleton. The parts of mandible are a horizontally oriented, U-shaped, anteriorly placed body and two vertically oriented, quadrilateral shaped rami which project upwards from the posterior ends of the body on either side. Let us look at the borders and surfaces of body of mandible. There are two borders and two surfaces. This is the upper border. In case of adults, it has got 16 sockets. So each half of the body of the mandible will have 8 sockets. 2 for incisors, 1 for canine, 2 for premolars and 3 for molars. This is the inferior border or base of the body of mandible. The two surfaces are, this surface is known as external surface or the outer surface. This surface is known as the internal surface or the inner surface. Coming to ramus, ramus has got 2 processes, 4 borders and 2 surfaces. The 2 processes are, at the anterior-superior aspect, there is a flat triangular process known as coronoid process. Posterior-superiorly, the process is condylar process. The upper end of the condylar process, this is expanded from side to side. This is known as head of the mandible. It articulates with the temporal bone and forms TM joint, that is temporomandibular joint. This is the only movable joint in the head region. Just below the head, there is this constricted narrow area. This is known as neck of the mandible. On the anterior aspect of the neck, here we can see clearly there is a depression and this is known as pterygoid fovea. The 4 borders of the ramus, they are the superior border, which presents a notch. This notch is known as mandibular notch. Inferior border, this inferior border is continuous with the inferior border of the body of mandible to form the base. Then we have a sharp anterior border and a rounded posterior border. The point where the posterior border of the ramus meets the inferior border of the ramus is known as angle of the mandible. The 2 surfaces of the ramus are, this surface is known as lateral surface or outer surface, and this surface is known as the inner surface or the medial surface, where we can clearly see a foramen known as mandibular foramen. Now coming to some features of the surfaces of body of mandible. We'll begin from the outer surface. Right in the midline, there is a faint ridge. This is known as symphysis menti. This represents that fusion of. Okay, so let us look at some features of the body of mandible. We'll start with the outer surface. Right in the median plane, we have a faint ridge. This is known as symphysis menti. This represents the fusion of 2 halves of the mandible. At the time of birth, the 2 halves of the mandible are connected to each other via fibrous tissue, which later ossifies, and the fusion is complete by the end of first or second year. At the lower end of this ridge, it is expanded to form a triangular prominence which is known as mental protuberance. At the two ends of the mental protuberance, we have slightly elevated areas which are known as mental tubercles. Now, just below the incisors, there are two depressed areas on either side of the midline known as incisive fossa. If we move more laterally, we find there is a foramen, and this foramen is known as mental foramen. This mental foramen in adults is midway between the lower and the upper border and between the two premolars. The direction of the foramen is upwards and backwards in adults. There is another structure here which you can faintly see. There is a line, and this line is known as oblique line. This oblique line extends from the anterior border of the ramus of mandible till the mental protuberance. Let us look at the features of the internal surface of body of mandible. Again, we will begin with the midline. There is even more faint ridge on the inner aspect of the symphysis mentae, and just below that we have usually 4 tubercles, but in this one we can see 3, right? So sometimes there are 3, there can be 2 also, and these tubercles are known as genial tubercles. So there are usually 2 upper genial tubercles and 2 lower genial tubercles. If we move more laterally, then we find there is a ridge here extending, you can see, just below and behind the socket for the last molar tooth, and it is going downwards just below the inferior genial tubercle. This ridge is also known as mylohyoid line, which you can see clearly now here. This is the mylohyoid line. Just below the mylohyoid line, there is a depressed area, and that is known as mylohyoid groove. Now, there are 2 areas which are separated by this ridge. Below the posterior end of the mylohyoid line, this area is known as submandibular fossa because submandibular gland will be lodged here. Above the anterior, I think now it is clear, above the anterior part of the mylohyoid line, the smaller depressed area, this is known as sublingual fossa. And the sublingual gland will be located here. So these are the features of the surfaces of body of mandible. Let us look at the ramus. When we see the ramus, we find the lateral surface is ridged and is slightly rough because of attachment of a muscle known as masseter. On the medial aspect, on this side, we can see here, there is a big foramen. This foramen is known as inferior, this is known as mandibular foramen. See some features of the ramus of mandible. The lateral surface, it is ridged and is rough here as it provides attachment to a muscle known as masseter. And when we look at the medial surface, slightly above the middle of the ramus, we find there is a big foramen here. This is known as mandibular foramen, right? The nerves which will supply the lower teeth and the blood vessels, they will pass through this foramen and run in a canal which is there inside this. And this will open on the outside as this mental foramen. The anterior margin of the mandibular foramen, there is a triangular tongue-like process which is known as lingula. We will now see the muscles and the ligaments attached to the mandible. Let us first consider the muscles attached to the outer or the external surface of the mandible. All the muscles attached here are taking origin from here, and that's why they have been shown in pink color. One can use red color also to show the origin. Along the oblique line, we have three muscles attached, and these are, first one, this is buccinator, the muscle of the cheek, and this takes origin from the upper part of the oblique line opposite to the molars. The second muscle is the depressor anguli oris. This muscle will be inserted at the angle of the mouth. A little above and anterior to this, we have the attachment of depressor labii inferioris. This muscle is inserted onto the skin of the lower lip. Along the incisive fossa, we have attachment of two muscles. The lower one is the origin of mentalis muscle, which is inserted to the skin of the chin. The upper one is the attachment of the deep fibers, the incisivus fibers of orbicularis oris muscle. Okay, so now we will consider the muscles that are attached to the inner surface or internal surface of body of mandible. We'll start from the midline. We have four genial tubercles, two superior and two inferior. The superior genial tubercles, they provide origin to genioglossus muscle. These paired muscles, they are the muscles of tongue. As the name suggests, glossus means tongue. Inferior genial tubercles, they provide origin to a pair of geniohyoid muscles, and these muscles will be inserted onto the hyoid bone. Mylohyoid line, that provides origin to mylohyoid muscles. The muscles from both the sides, they meet here in the median raphe and are inserted here, as well as onto the hyoid bone. These two mylohyoid muscles, they form the floor of the mouth. This muscle, which is taking origin from just below and behind the socket of last molar tooth, is the superior constrictor of pharynx. Okay, now let us look at the structures attached to the base of the mandible. We can see here three colors. Pink color indicates a muscle takes origin from this place. Blue color indicates a muscle is inserted here. And the green color, that means a fibrous tissue is attached here, which could be a raphe, a fascia, or ligament. In this case, it is fascia. So let us see which three structures are attached to the base of the mandible. Right next to the midline, we have a small depression here, which provides origin to anterior belly of digastric. Along the base, we have insertion of platysma. This is the muscle of neck, and this is present in superficial fascia. The green color here, that indicates or shows the attachment of investing layer of deep cervical fascia. Muscles attached to the ramus of mandible. All the four major muscles of mastication, that is masseter, temporalis, lateral pterygoid and medial pterygoid, are inserted on the ramus of mandible. Let us first consider the insertion of masseter muscle. This muscle is inserted on the lateral surface of the ramus, including the angle of the mandible. The muscle takes origin from the zygomatic arch above. The second muscle, which is inserted here, we can see on the coronoid process, is the temporalis muscle. This is inserted to the posterior border, apex, anterior border of the coronoid process, as well as anterior border of the ramus. It is also inserted on the medial surface of the coronoid process. This muscle, as the name suggests, takes origin from the temporal fossa and the temporal fascia above. Lateral pterygoid, this is inserted on the pterygoid fovea. Besides that, this muscle is also attached to the articular disc and capsule of the temporomandibular joint. Medial pterygoid muscle is inserted below and behind the mandibular foramen on the medial surface of the angle of mandible. This area is roughened here for the insertion of medial pterygoid muscle. Ligaments attached to the mandible. There are 3 ligaments that are attached to the mandible. Let us consider first this ligament, which is attached to the posterior aspect of the neck of the mandible. This is temporomandibular ligament or the lateral ligament. This is the true ligament of the temporomandibular joint because it supports the articular capsule of the temporomandibular joint. The other end of this ligament is attached to the articular tubercle of the temporal bone. The other 2 ligaments are the accessory ligaments of the temporomandibular joint. The ligament that is attached to the angle of the mandible is the stylomandibular ligament. As the name suggests, its other end is attached to the styloid process. This ligament, in fact, is condensation of the investing layer of deep cervical fascia. It separates 2 major salivary glands, that is the parotid gland, which is located here, and the submandibular gland, which is located here in the submandibular fossa. The third ligament is attached to the lingula, which is present here just anterior to the mandibular foramen, and this ligament is sphenomandibular ligament. The other end of this ligament is attached to the spine of sphenoid. This ligament develops from the first pharyngeal arch. There is a fibrous raphe which is attached to the mandible just behind the socket for the last molar tooth. And this fibrous raphe is pterygomandibular raphe. Its upper end is attached to the pterygoid process of sphenoid bone. And this fibrous raphe that gives origin to 2 muscles, anteriorly to the buccinator and posteriorly to the superior constrictor of the pharynx. Okay, let us look at the nerves related to the mandible. There are 6 nerves which are closely related to mandible, and they might get damaged or injured in case of fracture of the mandible. Now, here, this represents the posterior division of the mandibular nerve, right? So it has got 3 branches, and all the 3 branches at some point come in close relation to the mandible. The first one you can see here, this is the auriculotemporal nerve. This is related to the medial and posterior aspect of neck of the mandible. The second one, this is inferior alveolar nerve, which enters the mandibular canal and supplies all the lower teeth. But before it enters the mandibular canal, it gives a branch here. This is nerve to mylohyoid, which will pierce the sphenomandibular ligament and run in the mylohyoid groove. It supplies 2 muscles, and these 2 are the mylohyoid muscle and the anterior belly of digastric. The third branch of the posterior division of mandibular nerve is the lingual nerve. This comes in close relation to the mandible, close to the or just below and behind the socket of last molar tooth. So during extraction of impacted last molar tooth, there may be chances that this nerve can get injured. So one has to be careful. The other 2 nerves which are related to the mandible, they are, this is the nerve which emerges from the mandibular notch. It is a branch of anterior division of mandibular nerve, and this is the masseteric nerve. This nerve supplies the masseter muscle. And the last one, that is, this is actually a branch of the inferior alveolar nerve, that is mental nerve, will emerge from the mental foramen. This will supply the skin of the chin. So inferior alveolar nerve actually runs in the mandibular canal, and at this level divides into two branches: incisive branch, which will supply the incisors, and the mental branch, which will emerge from the mental foramen to supply the skin of the chin. Now let us consider the arteries that are closely related to the mandible. But before I do that, let us identify the arteries in this clay model. So here you can see this is the external carotid artery, and this is the facial artery, a branch of external carotid artery, and this is maxillary artery, which is one of the terminal branches of external carotid artery. Now there are 6 arteries which come in close relation to the mandible, and these are in the submandibular fossa. This is the facial artery, which forms a S-shaped loop. It actually runs first along the posterior aspect of submandibular gland, then it turns downwards and reaches the base of mandible, and after that it curves around the base of mandible to reach the lateral or external aspect of mandible. Second one, this is the maxillary artery, which is related to the medial aspect of neck of the mandible below the auriculotemporal nerve. We can see here maxillary artery branches which come in relation to mandible. This is inferior alveolar artery, which will pass through the mandibular foramen, and it gives a branch here which is known as the mylohyoid artery. There is another artery which comes in relation to the mandibular notch and will reach the lateral surface of the ramus of mandible, and that artery here we can see is the masseteric artery. Now I'll tell you about the important age changes that occur in mandible. This is the mandible of a child, this is of an adult, and this is of an old person. Let us look at the mental foramen. If we look at the mental foramen, in case of children, it is very close to the inferior border. The mandibular canal also runs close to the inferior border of the mandible. The position of mental foramen is just below the first deciduous molar tooth. In this case, the alveolar bone containing the sockets for the teeth is well developed, whereas the subalveolar bone is not that well developed. In case of an adult, the mental foramen lies midway between the upper and the lower border, and it is present between the two premolars. The direction of the foramen is backwards and upwards. In case of children, it could be upwards, and in infants it is forwards. The mandibular canal lies midway or runs midway between the upper and the lower border. Here both the alveolar part and the subalveolar part are equally well developed. In case of an old person, the teeth are shed, the alveolar bone is resorbed, we cannot see sockets here, and the mental foramen lies close to the upper border. Second change we will see in the angle of the mandible. In case of young person, the angle of the mandible is more, approximately 140 degree. Coronoid process is higher as compared to the condylar process. In case of an adult, the ramus is more vertical, so the angle has decreased and it is approximately 110 degree. The condylar process is slightly higher than the coronoid process. In old age, again it is back to that of a child. The angle increases to 140 degree. So these are some of the important changes that occur with age in the mandible.